And so the next speaker is Dr. Radha Ramanan, because we have prescribed a spectacle, but many people come back with problems. So Radha Ramanan sir is talking about what is spectacle intolerance and guidelines to prevent spectacle intolerance.
Good morning. Thank you, Dr. Andrews, for giving me the opportunity. And we have heard about how to give the prescription, how all this thing is. But our main problem is some of the patients will be coming back with a lot of complaints. Say sometimes it won't be our problem, but you have the responsibility to correct it. It's a common challenge. It's not that rare. It is a biggest insult. See, you know that most of the clinic, patient will come and tell you, my earlier glass was better. So this is a very tricky situation. And with the introduction of the progressive lenses, these complaints are increasing. Like bifocals, you know that different types of bifocal, you should know which patient you have to give that particular bifocal, you have to discuss with, otherwise the patient will come back. And one of the problem with the bifocal is the image jump. So they will come and tell that I want only one glass. Most of the people will come and tell you. So you have to explain it properly. And you have to encourage them to use it. And you have to tell them this is a natural thing. This is not a, they are intolerance, but it's not actually a problem. Actually, Dr. Andrews has shown all these things. When you explain all these things to the patient, you should know what is the structure of a progressive lenses. In this area, patient will go on complaining that I am seeing everything angle like this. This is a common thing when you give progressive. So we have to teach them how to use it. Every patient, if you give it, they said, all these things they will go on telling. So you have to select the progressive lens candidates. Previous progressive lens wearers is fine, but only thing is if they are using a wide intermediate zone, they shifted to a narrow zone for reduce the price, then they will have all sorts of things. First time users, we can encourage them to use progressive lenses, and highly motivated people. Some of the youngster, comparatively youngster, 40 plus and all, previously it was all females, they want progressive, now it is everyone. Difficult people are high-ad people, previous wide segment bifocal users, individual sensitivity to vertigo and motion sickness. Sometimes this we won't consider, right? Individual sensitivity to changes in vision. Some patients go on changes their vision, some glaucoma patients, diabetic patients, and all that thing you have to be very cautious. The prevention is a very important thing. So always take the history of their occupation and what is their need. So one patient was complaining about he cannot tolerate it, bifocal, all this thing. I was given glasses 2 or 3 times. But finally only he told, he is a KCB meter reading person. He wanted the near vision on the upper part. So he realizes later, careful refraction is very important. End of the refraction, check with the patient's old glass. Whether you are doing or your refraction is doing, you do discuss with the patient what he wants. Don't prescribe it straightly. Measurements are very, very important. You can take the IPD. IPD you can take with the, you can select the frames also, very important. IPD measurement, you can use earlier types optician's role, still it is very useful. And you take the IPD, not only by this method from one eye to other eye, you have to measure it individually for every side, right eye and left eye, because there are a lot of facial asymmetry. One patient comes and tells you, last time also I had the problem. Is an indication that he is having some asymmetry or something. But be careful on that type of patients. Frames must be comfortable. Lens should be perpendicular to the vertical axis. Bridge also should be very convenient. Metal frames, sometimes the nose pad will tilt and they will come back with a lot of problems. You check the glass power, it is accurate, but again the patient will come back and tell you that it is not tolerable. And frames should not be on the apple of cheek, say some fluffy fatty people, they will have a lot of problems. Should not cover the eyebrows. If it is going too closer to the eye also, round frames is not that common now, but lens can rotate in that thing. Vertex distance is extremely important, especially in high errors. Your optician should fit the lens to the anterior focal point, should be large enough to give wide visual field, and the vertex distance should be same as the trial frame. That is very important. Sometimes the patient, your optician or optometrist will keep the trial frame in a different distance, and when the patient's frame is coming, it will be in a different position. So you can read, you should ask your optician to fix after taking all these measurements. Vertex distance is very important. You can take it. If the vertex distance is varies, then his field will vary, because you know that if it is much friend, see that field of vision is reduced, he cannot read it. Sometimes when you check it, every power is correct. You have to ask the patient to wear it and check it, how it is. And pantoscopic tilt is a very important thing. It brings the near zone closer to the eye and increases the field of view through the zones. It should be, what is pantoscopic tilt? It refers to the frame alignment in the up and down positions. Pantoscopic, the lens bottom is rotated towards the cheek. If it happens in the opposite way or it is in the straight, again the patient will have problems. It should be rotated towards the side. So it's very important. You have to check in every spectacle intolerance and this thing. Sometimes the tilt is okay, but when the patient wears, the optician will check it. Tilt is okay, or 10 degrees, 15 degrees, they will tell okay. But the patient will go on complaining it is not suitable, because the patient's ear position will vary. So every patient is different. So some patients, if you wear it, the tilt will change according to the ear position. Face form wrap is another important thing. You have to have the round wrap. If it is very straight, patient will have, on the extreme gazes, patient will have problems. Now the picture is changing. It is now coming to the, all these measurements were taken earlier with the manual methods and all. Now the whole thing is, scenario is changing. You can get every measurement taken in different machines. So I don't have any interest on this thing, but I tried interest. But this is a machine which uses by the SLR groups. They have a Visio office. Now it is more commonly, most of the systems uses what you call the eye partner. So it's so easy for the optician. It takes all the measurements, this thing for fitting the lens. So the lens also will be manufactured according to that thing. You take the patient in front of this machine. This is a screen and there is a machine standing. You can take all the measurements in the machine. It will give you all the readings. So manually you can take only few readings. Here you will get all the readings. And this is another machine used by other company. This is, now it's a time of virtual thing. Everything is virtual. You can even have a optical shop. The next generation, you don't have even a real optical shop. You will have a virtual optical shop. You can select everything. So with this thing, you can wear this thing. This is according to our pattern of movements. The AI, artificial intelligence, will come into that fact, and the lens will be manufactured according to that particular person. So it is totally changing. The scenario is totally changing. You have to ask the patient to wear this thing. This is a frequency map, you get it. So how frequently, because there will be an image projected into the AR, this VR thing, and the way he moves and looks, according to that thing, the progressive lens will be made. This is the AI introduced progressive things. Now it's available now in Kerala. So the metamorphs will come, and this is I am trying it. So this is a possibility of field now. So our responsibility definitely to tell the patient. Most of the time we learn everything, but we won't learn any refraction. Proper counseling of the patient who is wearing specs for the first time, shifting to the bifocal, changing the frame size, everything. We have to counsel it. Never assume. When the patient comes and tells you, I have a problem, we have a tendency to tell them, no, you don't have any problem. Most of the time, patient will be right. You are not able to detect it. So thank you. So
thank you, Dr. Ramanan. So after for the enriching with spectacle enrollments, so we have seen enriching refraction, then selection of spectacles, spectacle enrollments. Radha told that now everything will be virtual, but at least for 10 years there will be optical shop will remain. So